Dr. Jeff Pothof with UW Health is joining us now. And Dr. Pothof, I want to ask you first, what is your reaction to the senator's statement, to that news conference, and to news that there are people that are having severe side effects?
Yeah, I think the first thing is we don't want to marginalize these people who are clearly going through something that's very, very difficult. At the same time, we do have robust processes in place that evaluate adverse reactions to vaccines. And for the COVID vaccine, we're identifying things at a really high resolution, with Johnson & Johnson blood clots at the rate of just a couple per 1 million, heart inflammation with the other two vaccines at a rate of maybe 20 per million. These individuals at the news conference, those symptoms are so rare, we're not even sure that they're related to the vaccine. There needs to be a few more cases. But I think context is important. We're looking at adverse side effects at the rate of just a couple per million people who get vaccinated. Now, on the other side, we have to look at people who get COVID. What happens to them? If you gave 1 million people COVID-19, 18,000 of them would die. So clearly the risk is on not getting vaccinated. The biggest problem we have with the vaccines is not enough people getting them.
And so in your opinion, was it irresponsible for the senator to hold that press conference in the way that he did?
I think what we need to do is we have to put these things in context. I don't want to belittle the suffering of these people who are clearly going through something, whether it's COVID related COVID vaccine related or not. But I think it's also important to look at the other side of the equation, which is the damage that COVID-19 has caused on this country, with 604,000 people